MPO deficiency and NBT. Normal, respiratory burst O2 to H2O2 is intact. O2 independent killing. Less effective than O2 dependent killing and occurs via enzymes present in leukocyte secondary granules, e.g., lysozyme in macrophages and major basic protein in eosinophils. Step 7. Resolution. Neutrophils undergo apoptosis and disappear within 24 hours after resolution of the inflammatory stimulus. Macrophages. Macrophages predominate after neutrophils and peak 2 to 3 days after inflammation begins. What are macrophages derived from? Monocytes in blood. How do macrophages arrive in tissue? Via the margination, rolling, adhesion, and transmigration sequence. What are the outcomes for macrophages managing the next step of the inflammatory process? Resolution and healing. 2. Continued acute inflammation, abscess, chronic inflammation. Macrophages induce resolution and healing by anti-inflammatory cytokines 1L10 and TGF-beta are produced by macrophages. Macrophages induce continued acute inflammation by persistent pus formation. Chelate from macrophages recruits additional neutrophils. Macrophages induce abscess by acute inflammation surrounded by fibrosis. Macrophages mediate fibrosis via fibrogenic growth factors and cytokines. Macrophages induce chronic inflammation by macrophages present antigen to activate CD4+ helper T cells, which secrete cytokines that promote chronic inflammation. Chronic inflammation is characterized by presence of lymphocytes and plasma cells in tissue. It's a delayed response but more specific, adaptive immunity than acute inflammation. T lymphocytes are produced where? Produced in bone marrow as progenitor T cells. T cells use TCR complex 4, TCR and CD3 for antigen surveillance. Activation of T cells requires what? 1. Binding of antigen, MHC complex and 2. An additional second signal. Activated CD4+ helper T cells do what? Secrete cytokines that help inflammation and are divided into 2 subsets. What are the subsets of activated CD4+? Th1 and Th2. Th1 subset secretes IL-2, T cell growth factor and CD8+ T cell activator, and IFN gamma, macrophage activator. Th2 subset IL-4, IL-5, IL-10. Th2 subset secretes IL-4, which results in facilitates B cell class switching to Ig and Ig-A. Th2 subset secretes IL-5, which results in eosinophil chemotaxis and activation, maturation of B cells to plasma cells, and class switching to IgA. Th2 subset secretes IL-10, which inhibits Th1 phenotype. What provides the second activation signal for CD8+, IL-2 from CD4+ Th1 cell? Cytotoxic T cells are activated for killing. B lymphocytes. Immature B cells are produced in the bone marrow and undergo immunoglobulin rearrangements to become naive B cells that express surface IgM and IgD. What provides the second activation signal? CD40 receptor on B cell binds CD4OL on helper T cell. What happens after the second activation of B cells? Helper T cell then secretes IL-4 and IL-5, mediate B cell isotype switching, hypermutation, and maturation to plasma cells. What is granulomatous inflammation? Subtype of chronic inflammation, characterized by granuloma, which is a collection of epithelioid histiocytes. What are epithelioid histiocytes? Macrophages with abundant pink cytoplasm, usually surrounded by giant cells and a rim of lymphocytes.